Welcome to this explainer. Today we're mapping out what is literally the ultimate biological superhighway, the human central nervous system. We're going to take a journey from its microscopic defenses all the way to how modern medicine steps in to rebuild it when things go, well, catastrophically wrong. Let's get right into it.
Now, to truly appreciate the sheer resilience of the human body, we first have to understand what happens when its most invulnerable seeming fortress is breached. Think about it for a second. Your nervous system dictates absolutely every move you make, every breath you take. But how exactly does it safeguard those functions? And, more importantly, how does it adapt and recover when a catastrophic failure occurs right along its main highway? So to answer that, we've broken this down into 5 quick chapters. First, the central processing unit, then the armor of the nervous system, next is the spinal cord highway, followed by when the system fails, and finally, rebuilding through physiotherapy. All right, Chapter 1, the central processing unit. You can kind of think of the central nervous system as your body's ultimate CEO. Made up of the brain and the spinal cord, it is incredibly resource hungry. It hogs roughly 30% of your body's oxygen just to interpret your senses and keep your organs running smoothly. The spinal cord then acts as this essential bridge, carrying all those vital commands down to the rest of your body. Now, behind that CEO is a microscopic workforce of around 100 billion neurons. But here's the crucial takeaway. Neurons are, well, they're kind of divas. They absolutely cannot survive without their glial support staff. You've got astrocytes constantly scanning for damage, microglia acting as the dedicated cleanup crew, and oligodendrocytes greasing the tracks with a myelin sheath to ensure we get that lightning-fast signaling. Moving on to Chapter 2, Armor of the Nervous System. Because the brain is such a VIP, it requires 3 very distinct layers of security, known as the meninges. As you can see here, you have the tough, inextensible dura mater right on the outside, then the web-like arachnoid matter in the middle, and finally the super delicate pia mater hugging the cerebral cortex directly. Working together, these layers physically shield the CNS tissue. But physical armor just isn't enough on its own. The brain also needs a dynamic shock absorber. That's where cerebrospinal fluid comes in. It's constantly produced by the choroid plexus, circulates through the ventricles and subarachnoid space, and is then reabsorbed into the venous system. It's a remarkably elegant, closed-loop waste management and nutrient delivery system. However, and this is a big however, when trauma strikes, this exact armor can actually become a death trap. For example, if an artery tears, arterial blood pools outside the dura. We call that an extradural hematoma. On the flip side, if venous blood gets trapped beneath the dura, it's a subdural hematoma. In both of these scenarios, the rigid skull essentially turns against the brain, causing massive, dangerous spikes in pressure.
Which brings us to Chapter 3, the spinal cord highway.
Running down from your brainstem is a roughly 42-centimeter-long cylindrical bridge, and from it branch 31 pairs of spinal nerves. Crucially, these are mixed nerves. Think of them as two-way streets, carrying both the motor commands telling you to move and the sensory data allowing you to feel. If we were to slice right into this cable, the architecture is pretty striking. The H-shaped central gray matter acts as these local processing hubs packed with neuron cell bodies. Meanwhile, the outer white matter contains the highly organized, myelinated express lanes, basically shooting sensory data up to the brain and motor commands right back down to the body. Now, speaking of those motor commands, it is absolutely crucial to differentiate between the 2 types of messengers on this highway. Upper motor neurons originate way up in the cerebral cortex, travel down through the spinal tracts, and largely cross over to the opposite side. Lower motor neurons, however, start right in the spinal cord's ventral horn and extend directly out to control your skeletal muscles. We really have to know this distinction, because damage to the upper pathways looks and behaves entirely differently in a clinical setting than damage to the lower pathways. Okay, Chapter 4, when the system fails. So what happens when this superhighway is damaged? Well, the resulting deficits are incredibly specific. If you have a hemisection, basically cutting half the cord, known as Brown-Séquard syndrome, you'll actually lose movement on one side, but lose pain and temperature sensation on the exact opposite side. Crazy, right? Or take a severe neck hyperextension causing central cord syndrome. Surprisingly, it paralyzes the arms and hands far more severely than the legs. Beyond direct trauma like car accidents or falls,
which, by the way, account for about 90% of all spinal cord injuries, the system faces other really severe threats. It can be compromised by congenital anomalies like spina bifida, where the neural tube fails to close. It's also super vulnerable to infections like meningitis inflaming those protective armor layers, or even severe nutritional deficits, like a lack of vitamin B12 can literally cause the spinal tracts to demyelinate and degenerate. So the system is resilient for sure, but its enemies are incredibly diverse.
And that brings us to our final section, Chapter 5, Rebuilding Through Physiotherapy.
According to the latest comprehensive clinical practice guidelines out of Australia and New Zealand, recovery is definitely not a quick fix. It requires a highly specialized, multidisciplinary team stepping in from the very start. The new standard of care makes it crystal clear. Rehabilitation for a spinal cord injury is a deeply human, person-centered, and collaborative lifelong process. Because high spinal injuries often paralyze the abdominal and breathing muscles, the absolute first priority for physiotherapists is lung health. They use targeted interventions like respiratory muscle training to strengthen those weakened muscles. Or they might simply apply abdominal binders when the patient is sitting up to artificially boost lung volume. Interestingly enough, just laying a patient flat on their back in a supine position can temporarily improve lung capacity when core muscles fail. It's a vital yet incredibly simple intervention to clear airway secretions. Now, once the airway is secure, the modern clinical focus shifts rapidly from passive care to active, task-specific training. Passive movements alone just won't cut it anymore. The evidence strongly demands combining functional electrical stimulation with actual voluntary resistance training. It's all about relentlessly focusing on actual motor skills, real-world survival skills, like mastering a wheelchair transfer, while using long-duration stretching to manage spasticity. These standardized guidelines are a real game changer because they empower both clinicians and families by clearly distinguishing between what confidently works and what doesn't. For example, using arm supports to prevent subluxation or doing upper body aerobic exercise. Those are strong recommendations. But crucially, the guidelines also explicitly state what not to do. For instance, doing gait training for patients with zero voluntary lower limb movement is strictly non-recommended. That highly valuable therapy time is much better spent mastering wheelchair skills. So we'll leave you with this final thought. From the microscopic astrocytes repairing tissue all the way to the tailored, lifelong physiotherapy helping a patient master a wheelchair transfer, the human body's drive to communicate and recover is truly astounding. As science pushes the boundaries of rehabilitation, how much further can neuroplasticity take the human nervous system's incredible capacity for recovery? It's a question that absolutely redefines what is possible in rehab. Thanks so much for joining me for this explainer. Keep learning, and we'll see you next time.